Thank you for sitting with us today. If you're watching this video, you either have bipolar disorder or know somebody or have someone in your direct family that does. So we're here to give you a little more information about bipolar and hopefully answer some of your questions. In order to fully understand bipolar disorder, we are going to first focus on the concept of mood. Mood refers to your emotional state or prevailing state of mind. Mood plays a large role when discussing bipolar disorder because it distorts the way you see the world. Bipolar is going to involve intense mood swings, which make the world around you or the person you know a strange and unsettling place. In order to diagnose bipolar disorder, hypomanic or manic symptoms must be present. In this video, we will discuss psychological, social, and biological potential causes of bipolar disorder and briefly discussing depression. Bipolar disorder, also known as manic depressive illness, involves unusual shifts in moods, energy, activity levels, and interactions in everyday life. 4 types of bipolar disorders include bipolar I disorder, which is characterized by the presence of manic episodes that last at least 7 days. Bipolar II disorder is defined by a pattern of depressive and hypomanic symptoms, but no manic episodes are present. This is key when diagnosing. Next is cleothalamic disorder. Involves numerous periods of hypomanic and depressive symptoms, but do not meet the requirements for a manic or depressive episode. Lastly, there's an unspecified category. This category does not mean any of the requirements I just said. So sit down with the person you know, or assess these yourself, and see which bipolar disorder seems like the symptoms you are having, and then meet with a therapist or psychologist, and they'll be able to go further. Next, I wanted to briefly discuss the cognitive effects of bipolar disorders. These are going to include malfunctions in your brain chemicals such as serotonin, dopamine, and neurohydrolene. Also, this is going to lead to worsening cognitive functioning. And recent studies shows that higher number of manic episodes in bipolar patients have been associated with less gray matter volume in the prefrontal brain areas and during cross-correctional studies. This basically means that they took people with bipolar symptoms and healthy patients and studied them side by side so they could compare the results.
We are unsure of what causes bipolar disorder today. However, behaviorally, it could be triggered by certain stressors in life, such as divorce, death of loved one, or so forth. Patients with bipolar disorder are more likely to have a parent or direct family member who has had a mood disorder. Altered health habits include alcohol abuse, drug abuse, or hormonal problems can trigger an episode and make treatment difficult. Symptoms of bipolar disorder fall into 2 categories, mania and depression. Mania symptoms are talking excessively, racing thoughts, hostility, loss of sleep, and delusions. Depressive symptoms are extreme fatigue, prolonged sadness, memory loss, poor nutrition, and increased sleep. Now we are going to talk about treatments for this disorder. Treatment is usually lifelong and involves a combination of medications and psychotherapy. Therapies that can be done are support groups, cognitive behavioral therapy, psychoeducation, family therapy, and psychotherapy. Medications that are taken are mood stabilizers, antipsychotics, and antidepressants.
Families can play an integral role in helping one's child with bipolar disorder. The first step they can take is educating themselves on the disorder in general, specifically focusing on rage. They need to understand the biology behind these aggressive and possibly violent episodes. These episodes can last for hours. Irritability often spikes when the child first wakes up. The parent should make sure to be cautious in the morning. Another way families can help support their child is setting them up with a psychiatrist. Proper medication is vital in mood stabilization. Another way families can help is by seeking therapy, specifically family-focused therapy. This helps the parents learn skills when dealing with possible manic episodes or disruptive behavior. They use these techniques to reinforce positive behavior and reduce frequency of outbursts. There are certain things parents should also avoid doing, like severe punishment, screaming fights, and nitpicking.
Families with individuals that struggle with bipolar disorder have a hard time understanding what it's like and what that person feels like on a day-to-day basis. People with bipolar are constantly thinking that they'll never be normal again. Once diagnosed, they feel it as if they did something that initiated this condition. The hardest part about living with bipolar, in my experience, would be trying to manage the medication. It's a tricky game of trying to find the perfect balance between mood stabilizers and antidepressants. It's hard because while taking the medication, you'll have days where you actually feel normal for once, but then there's times where you feel extremely manic or depressive creeping back in, and that's when one must take note of an imbalance in their medication. A friend of mine recently was having a severe manic episode for a few days, and that's when he realized his medication needed to be rebalanced. It's a difficult guessing game to manage, making it feel like it's a never-ending cycle of trying to get better, which results in you feeling like you'll never be normal again. On top of managing your medication feeling almost impossible, many people don't want to take their medication because of how it makes them feel. The first person I'd ever been in a serious relationship with struggled with bipolar disease, and the biggest fight with him would be taking his medication. He hated the way it made him feel, mostly because he didn't feel anything while taking it. He didn't have any emotions. He did not feel happiness, he didn't feel sadness, and he didn't feel like he had any other way to feel anything other than not taking his medication. Not taking your medication can be a problem because it can lead to those suicidal thoughts. Another difficulty that people with bipolar disorder face with their medication is the fact that it causes a lot of suicidal thoughts. This is a slippery and scary slope. A lot of what I have to say comes from solely experience with people that I know who have bipolar disorder. On medication or not, suicidal thoughts do occur. There's days where you could be taking your medication, and although you feel like you have it together, the next few days you could be feeling as if there's no reason to live, and that is the scariest part. The worst part is when it actually turns from thoughts to actions. When this happens, it's important to stay by the individual's side, reminding them of how amazing they are and how they aren't alone, listening to them, and if they don't want to talk, just be there for them. People living with bipolar feel like they are alone most of the time because they don't feel like many people can relate to their ongoing mood swings that vary from day to day.
Thank you for listening to our presentation today. If you or someone you know has bipolar disorder or has any suicidal thoughts, please reach out and get help. Thank you.